Oh, welcome. What we're going to take a look at today is the five elements in the management of musculoskeletal disorders and how we can actually utilize that in order to make a quicker assessment and diagnosis. So it just gives you a little bit better understanding as to how you can utilize some of the TCM aspects, but looking at it from a more Western terms as to how you can quickly locate points and also decide what meridians they need to be on in order to get the best treatment outcome. So the main objective of today is to give an understanding of the meridians and also their function with regards to musculoskeletal disorders, understanding of the five elements and selecting meridians based on the five elements in the management of musculoskeletal disorders. What I want to start off looking at is the term chi. What is the actual term chi? What's it actually mean? Now, I don't want you to just discard the term chi, because what you've got to bear in mind is this is something that the Chinese was trying to explain 3, 4 or even 5,000 years ago. So therefore, at the time, they've got this energy that's buzzing around throughout life, throughout the environment and also within the body. And they're trying to explain this. They'll talk about the free flow of chi. If it doesn't flow freely, then it's going to also cause ill health and starts to disrupt the function within the body. Now, what I found was quite interesting is if you look at somebody such as Dr. Robert Becker. Now, he's an orthopedic consultant and he also looked at a lot of acupuncture points and things to do with acupuncture. And he wanted to know, with regards to what causes healing, once you've cut into something and you stitch it together, what makes it heal? Why does it heal? So what he basically did was to take a couple of salamanders, poor little things, chopped off the tail and observed under a microscope what was happening microscopically. And what he basically found was the regrowth of their tails. What he basically found was there was a significant increase in electrical activity. So therefore, those are the ones which didn't have a good nerve supply, was a significant reduction in electrical activity. Therefore, the tails grew back a lot slower or it didn't grow back at all. Several other researchers demonstrated that if you look at somebody with diabetes and they've got peripheral neuropathy, their ability to heal is significantly compromised. One thing to bear in mind is all cells within the human body is positively, negatively charged. We all give off energy. You can build up static energy. So those energy we all give off. If you're running on a low ebb, then that's an individual more susceptible to ill health. And this is the energy that they're actually referring to. And this is the energy, once you start looking at some of Dr. Robert Becker's work, once you start looking at meridians and how you can detect, in this day and age, you have got devices that will detect acupuncture points. And these acupuncture points has a different electrical polarity to the surrounding skin. So therefore, you are talking about an energy system within the body. So that's been shown and that's been proven, and now you have devices that can detect these and show they actually exist. So once you start looking at chi, don't rule it out, don't disrule it. It's just a case of their ways of explaining something that they didn't quite understand at the time. But now we've got a better explanation, we've got a better understanding as to what it is. So therefore, you do need to understand that. So once you start talking about chi, it is a system, it is the energy within our body itself. All living things emits a certain amount of energy. So it is put forward to say, as chi is vital to life, if it flows poorly or it's deficient in any way, then you're more susceptible to painful conditions, and also the organs may not function properly. Same again, if you look at chi where it's in excess, then that can also result in excessive function of that organ. You can look at it from a sympathetic, parasympathetic viewpoint. If something's getting too much sympathetic stimulation, it's going to start having a knock-on effect and start to have a bad effect on that particular organ. Organ's going to overfunction, start to cause problems. If it's not getting a sufficient nerve supply to it, electric conductivity to it, then also it's going to directly have an effect on that organ. Ill health is going to actually result. So it's pretty much the same thing. It's just how you want to understand that. That brings us on to the 5 elements. I mean, in this presentation, we're not going to talk about yin yang because it's not really going to pertain much to how we want to understand it. But we can look at the 5 elements. And the 5 elements was mainly devised as a method of assessment and diagnosis from a traditional Chinese viewpoint. And it's still used today, depending on the style of acupuncture that's actually being used. What I mainly want to look at is more the emotional, the climatic aspects. So if you look at emotions, Chinese will classify that as an internal pathogen. If you look at the climatic influence or environmental influence, Chinese will classify that as an external pathogen. So each one of these can have an effect directly on your health, which we'll take a look at in a short while. Same again, each one of these will pertain to a meridian or a pair of meridians within the body. Body tissues, again, that's going to be quite important. So what we basically need to look at is what body tissues and what meridians they relate to. So if you have somebody come in with, say, for example, a bone problem, you're thinking, right, okay, I've got a fracture, what points do I use? Now, it's going to be easier for you to make that assessment and think, right, okay, if it's bone, I can go straight to utilising points on the kidney or the urinary meridian. If it's muscle, then I can go straight to utilising points on the spleen and the stomach meridian. So if we look at the different types of body tissues, and then we look at the meridians that they pertain to. So if you're looking at skin and also body hair, what you basically find with that, that's the lungs and large intestine. Now, they are mainly responsible for skin disorders, whether you're looking at psoriasis, eczema. They're points that is all mainly going to address such as that. So they're going to be quite important for that. Also, chest problems, those meridians will tend to address that. However, if you're looking at muscle, and you're looking at muscle mass, more the strength of the muscle, you're looking at the spleen and stomach meridian. If you're looking at connective tissue and the repair of connective tissue, you're looking at the stomach and spleen meridian. If you're looking at nerves and nerve conductivity, you're looking at spleen and stomach meridian. Most important thing also within that is you do need to choose the most potent points within those meridians. If you remember that, you can't go too far wrong with your point selection. Key thing is, if you're looking at spleen and stomach meridian, your 2 most effective points is going to be spleen 6, stomach 36. Can't go too far wrong with those 2 points at addressing most musculoskeletal disorders. If you're looking at blood vessels, then it's going to be the heart and pericardium. And that will also, not just the blood vessel, but also the heart in itself, the function of the heart. Then again, that's going to be points along the heart and also the pericardium meridian. They're going to be your 2 most dominant meridians for addressing that, where you can calm the heart down, reduce blood pressure. So that's pretty much what those points will do. And that's where you're going to be looking at pericardium 6 and heart 7. Those points are going to be very, very effective at achieving that goal. As we were saying beforehand, if you're looking at bone and joints, that's mainly going to be your kidney and your urinary bladder. If you're looking at the spine, for example, your urinary bladder points are going to be your main points you're going to utilise for back disorders. Particularly if you're looking at points such as urinary bladder 51, that's also a trigger point that will also address most back problems, particularly if it's muscular. If you're looking at urinary bladder 23 and urinary bladder 25, they are also trigger points, but also will address more spinal and bone and chronic conditions of the back, and also any of the joints in the lower extremities. Urinary bladder 40, command point for the back. So you can go on, there's quite a lot of points that it will actually address. If you're looking at bone, it's urinary bladder 23, but also you're looking at kidney 3. They will address more chronic, like chronic knee, chronic ankle, chronic back problems. And then you've also got urinary bladder 11, which affects bone metabolism. It has a direct effect on the parathyroid. So again, it is important to understand, what points to use to get the best effect. So you can see where the meridian comes in, and also the tissue relating to that meridian may well come in. Now, once you start to look at the liver and gallbladder, they are also concerned with muscles and tendons. But however, the key difference is if you've got a tear within the muscle, then you're looking at your liver. And one main point is going to be liver 3. So you combine that with something like stomach 36, spleen 6, liver 3, you can't go too far wrong in treating soft tissue tears. What the liver will do is enhance blood circulation to the muscles and also to the tendons. Your command point for the tendons, or should I say your influential point for the tendons, is going to be your gallbladder 34. So again, you're looking at very strong points here, and that is quite a good point for treating low back pain, is your gallbladder 34, but more so neck and shoulder problems. And even though it's not located in the neck and shoulder, that point has been shown to outperform points directly, whether it's myofascial trigger points or acupuncture points within the neck and shoulder. So very, very good point for addressing things such as that. So if we look at how the TCM sees the cause of actual musculoskeletal disorders, they look at it from being caused from an internal pathogen or an external pathogen. I'll give you a little bit more example of that as we get a little bit more into that. Otherwise, pretty much from a Western viewpoint, trauma. So from a Western viewpoint, we don't see it as being an internal and external pathogen that may well cause that. So if we was to look at, start by looking at our external pathogen, wind is going to be one of the key things. And normally we're going to start to see wind or windy environment towards the end of the year. Once you start looking at September onwards, that's more so in the UK. And also once you start looking at early part of the year, it's quite windy. And that's, if you, one of the key things to bear in mind, any of you physical therapists out there, try and think about what time you start to see most of your neck and shoulder problems. And you're going to guarantee that is going to be the time, if I look at my clinic, that's when I'm going to see most of them coming in at that time, where they're getting draft and it starts to affect the neck and shoulder. Wind, as it's suggested from a TCM viewpoint, affects the upper body more in the neck and shoulder environment. So that's going to be quite important. It's going to cause things like sweating because it blocks the pores. It's going to also start to cause its headaches, tension type headaches, stiffness in the neck, stiffness in the shoulder. It's something that comes on very quickly, but then it can regress very quickly. And one of the other things is it will move about. It won't stay in one place. And you're going to find, once you start treating neck and shoulders, you will find it will move to different parts of the neck and shoulders. So that's going to be one of the key things to bear in mind. Now, cold, I'm sure we're all familiar with cold. What it will cause is joint contraction, more stiffening up of that joint, more the tendons, the vessels. Also, it's suggested to cause more stiffening of the actual meridians, more congestion. It'll cause headaches, back pain, pain in the lower limb, knee pain, joint pain generally. That's when it's going to basically cause difficulty in flexion and extension of the actual limb. And also, it's going to significantly delay any healing. One of the key things is, if you've got builders coming in where you've got that builder's bum that's been showing when they're bent over that hole, digging into it, particularly midwinter, exposing that part of the back, not good. It's going to cause severe stiffening up of that back. So therefore, if you are treating anybody at a certain time of year with a back problem, do get them to cover it up and get them to keep it warm. One of the main things I do point out, like if you look at myself, I'm a podiatrist as well as a physiotherapist. If I'm treating foot problems and it's in the winter, the first thing I'm going to advise my patient, if they'd have come to me in the summer, you can resolve that problem that much quicker. Once you start to treat it in the winter, it's going to take longer. Mainly because the circulation to that area is going to be very much more compromised. Most of your circulation is going to be to the core. So any tendons, ligaments in the foot, ankle or anything like that is going to take longer to heal when when there's cold weather about. So do be aware of that. And what I'm saying is the Chinese are pointing that out basically from utilizing the 5 elements in that basis. Now, damp is another one, mainly affects the lower limb. It can cause swelling and stiffness in the lower limb. It's something that will linger. So therefore, treatment is going to take that much longer, and it's something that's going to come and go. So that's where it's going to be more problematic. I'm sure any of you who's treated Achilles tendinopathy, that is where the problem comes in. Cold, damp weather is going to delay the healing of the Achilles tendon. One of the key things is when I used to treat a lot of military personnel, I used to hold a Midlands contract for the military personnel in and around where I was. And one of the key things, I could have somebody coming in with Achilles tendinopathy. They get posted out somewhere like Afghanistan where it's nice and warm at that particular time of the year. And they arrive there, they run, they do whatever activity they want. All the mileage starts to increase. But the minute they come back to the UK, the Achilles problem starts to come back. The UK is a cold, damp environment, especially in the winter. So therefore, that's where it's going to stiffen up. One of the most important thing is to advise your patient. Make sure that your patient is, if they've got wooden floors, make sure that when they're actually on that floor, they're not actually walking about barefoot. They're actually wearing socks or something around that Achilles tendon to keep it warm. Same again, if you're treating somebody with neck and shoulder problems and it's towards the end of the year or in the windier part of the year, advise them, keep the neck and shoulder warm, keep the wind off it, because that's going to aggravate it and delay the recovery process. So it is important to understand that. Therefore, you're going to get a better and quicker treatment outcome if you allow the patient to start implementing things themselves. Now, once you start to look at heat, again, environmental, a lot of that's going to be self-explanatory. Loss of electrolytes, cramp, fatigue, dry mouth, headaches, fever, depression. So they're kind of things that you're going to get from excess heat in that respect. Same again, excess dryness. Somebody who spends a lot of time in a room where they've got air conditioning, or in a car, air conditioning, or an old individual that may well spend a lot of time at home in the winter and they've got the central heating on non-stop. Then that's going to dry you out. And what it'll basically do is cause cracking of the heel. It'll cause person to dry out, scanty urine, thirst, and then also dry nose, dry cough. So those kind of symptoms are actually going to be what's going to start to present itself from more dryness. So it's more or less they're going to have to drink more water to help to prevent that. Now, what we're going to take a look at now is more internal pathogens. And these, to me, as well as your external, are very, very important. And these are things that I find in general with general physical therapists and healthcare profession gets overlooked. So what I'm saying to you here is it's important you consider these as part of your treatment. And the beauty of acupuncture and acupressure is you can address these alongside addressing whatever condition you're treating, purely by choosing the appropriate points. Points will treat more than one condition. So you choose points that will either address the musculoskeletal disorder in which you're treating, but also address the emotional aspects. Then you can't go too far wrong. So, for example, anger. Anger is one that will start to cause headache, and this is what I'm talking here is excess anger, or somebody who's been in a state of anger for a long time. You're going to see this in a lot of athletes, or somebody who's sustained quite a bad injury, purely because they're angry about the condition, and also they're angry that they're either going to miss an event or they can't train. That upsets them, and they dwell on that. Then the whole process can take that much longer. So to a certain extent, sometimes you need to treat the psychological aspect of that particular individual. Otherwise, it's going to prolong the recovery. So as I was saying, you've got headaches, abdominal pain, low back pain, hip, pain in the genitalia, and also knee and insomnia. So they're some of the things that's actually going to start to present. And that is going to start to affect the recovery. If they're not sleeping properly, that delays repair significantly. And also, if they're not sleeping properly, next day pain is going to be that much worse as well. So they're key things to bear in mind. Let me just give you a quick example of a patient that I was treating who came in severe pain. And in the end, to resolve the problem was just talking. Just literally talking to her. No physical treatment whatsoever resolved the problem. So to give you a quick example, I had a young lady, I've treated her several times before, played at a reasonably high level in football. However, what basically happened is at the time when she came, she was at college, but she was also doing a football at the same time, and she had major competitions coming up. But also at college, she had also major exams. I didn't know nothing about the competition or the exams at the time when she came. All she came in was knee pain, and what she'd basically done, or the explanation that was given to me at the time, is she stepped off a bottom step. She didn't actually go all the way to the floor, but she just kind of just went down slightly. I assessed the knee, and what I found was quite surprising was the intensity of the pain in which she was in. So as she's explained what's happened and the intensity of the pain, me just touching the knee, there was no swelling or anything there at all. And I couldn't understand as to how sensitized the knee actually was. So I just did a basic treatment, mainly used the 4 gates to try and calm things down a little bit, and also did some other points away from the knee because I thought it was quite sensitized, just to try and address that. And then advised her and her dad to go and see the GP just to get a scan or something on the knee, because there's something that I might be missing that I wasn't aware of that's causing so much pain. Cut long story short, I was going away on a holiday that particular weekend. While I was away, got a phone call. He's saying that the doctor won't allow them, won't refer them for a scan. Don't think there's anything wrong with the knee, even though she's in a lot of pain. Gave her some painkillers, sent her away. Cut long story short, the following day, the father took her to A&E. A&E then wrote to the doctor to say, because of the amount of pain that she was in, that he did wrong, he should have sent her for a scan. But anyway, cut long story short, there again, they couldn't find anything wrong at all. They'd scanned her, they'd done all sorts of assessment tests on her, nothing came up at all. Father rang me to say, look, can we come back in? I just want you to have another quick check of her. When she came back in, I had a look. By this time, she was complaining about her ankle as well as her knee. I turned her over, I assessed the back, thinking it might be coming from her back. It might be something just going amiss here. So I checked her back, just palpation of her back, same as the knee and the ankle, acute. I did some Japanese type assessment on her, palpated the stomach, all that acute. She just broke down on the sofa, on the couch, should I say, crying, purely because she's thinking there's something drastically wrong with her, because the whole body, wherever you're touching now, is in pain. And at that point, I left her in the room, took her father out of the room and said, look, there's got to be something else that I'm not aware of that's actually going on. I said, personally, is anything happening in her personal life, anything emotionally or whatever else that may well be going on? He says, well, yeah, the main problem that we've got with her at the moment is she's got this major tournament coming up. She's also got her main exams coming up, and they're all on the same day. She's doing very well at college, but she's doing very well at football. She don't want to miss the tournament, and they're all clashing. I said, well, best thing to do is to go back and explain to her to say, well, she can't do the football. She's going to have to do it next year because of the condition in which she's in. So she may as well just go away, focus on her college work, and then focus on doing the football the year after. Now, what I found quite surprising from that was 2 days later, a father phoned me up and said all symptoms of pain had gone. After he sat down, spoke to her, got to understand what the situation was, everything cleared up. So what you basically got now is a situation where somebody's worked themselves up to a state where the whole body is escalated in pain. Most of it was down to anger. So I've not treated her. I've not actually applied any treatment. Treatment that I did apply didn't work. But the minute you kind of got the brain to come out of that state and, think more rationally, problem resolved. There's many other cases that I could give you similar to that. So important thing that I'm trying to get across is if you're treating any athletes or even individuals and they're angry or frustrated or anything like that, they're things that needs to be addressed if you want them to recover quicker. So do bear that in mind. Same again, coming on to another one, worry and pensiveness. That will have a delayed effect on the ability to heal. It's going to start to upset the stomach. It's going to cause nausea. It's going to cause lethargy. And it's also going to cause them to have a low ebb, a loss of energy, feel exhausted. They're not going to be able to concentrate. So again, that's going to delay the whole healing process. So it is something, and this is where they get into an excess mode, which can start to affect the ability to recover. Grief is another one. I've treated many patients that suffered from grief and they're not sleeping properly. And now they're starting to get into more of a mental depressive state. They're picking up coughs, colds quite easily, and the whole immune response starts to diminish. So that is another area that can actually be addressed purely from your acupressure, and utilizing your acupressure points. It's going to have a big effect on the large intestine. You're going to find that if anybody's grieving, they've got any hypersensitivity, you're going to find that hypersensitivity is going to be that much worse while they're under that particular state of grief. Joy. Now, when he's talking about joy, it's not a case of, somebody's happy because they've received something or they're happy to be with somebody. It's joy where it's overwhelming, it's it's too much, It's somewhere where somebody's constantly thinking about something. It can make them agitated. It can give them restlessness, sleeplessness, palpitations. So again, it's kind of a slightly different circumstances of you being happy watching a film, or you being happy eating your favourite ice cream. It's where somebody's got obsessive with something, where to the extent they cannot stop thinking about it, but they're still in a happy state about it. But then they could be happy about something, but also very anxious about it at the same time. So that's where some of these conditions may well start to set in. Fear is another big area. If somebody's fearful of something, that can start to cause quite a few problems. And that is going to affect more the kidney. Like joy will affect more the heart. Fear is going to affect more the kidney. And the way in which it's going to actually affect the kidney from a traditional Chinese viewpoint controls the orifice, mainly the bladder and the rectum. So those two orifices is controlled by the actual kidney itself. Now, you need to ask yourself a question. If you scare them enough, what symptoms do you think will actually start to happen? And one key thing is, you scare somebody sufficiently, they will urinate and also defecate at the same time. So therefore, it's going to have a strong effect on the kidney and then cause them to do that. If somebody's in fear over a time period, they may well get incontinent. Or if they do have incontinent, you'll find that will be worse than what it normally would be. Children will wet the bed. If they're worried or fearful about something, they will wet the bed. So, 1 minute they've kind of grown out of wetting the bed. Next thing you know, they're wetting the bed, ran out the blue. That's because they're fearful of something. So again, other ways in which it may well cause problem is it may well start to get bone pain, knee pain, ulceration, IBS, irritable bowel syndrome. So it can cause several other symptoms that may well start to happen. Insomnia is going to be one of the key things that's going to start to affect from fear, because it's going to affect the heart, and it's also going to affect the kidneys as well. So these are key things to think about as part of your treatment protocol when you're thinking about how to approach. It is very TCM, but it has a very good impact on your treatment outcome. Thank you for listening. I hope you find this information useful. It's something you can keep going back to and refreshing yourself on. If you've got any questions on this at all, then by all means, email me, info@stevebailey.acupuncture.com.